purpose to come here really was to, I guess, to see if anybody wanted to talk about how to, because I'm not really so much into a debate about whether it's a good idea or not. It's more, I'd love to see the state of Tennessee, and I'm also talking with some attorneys. There's federal money that's involved, but medication-assisted treatment is tied to it, and there's a lot of federal money.
Yeah.
And the state of Tennessee hasn't figured out yet exactly what to do with that or how to do that. I think anybody that is appropriate for Suboxone that makes a decision that they want to stop using should have a faster path to see a doctor and have the resources to see a therapist. Trying to set up video counseling in these rural communities are hard. It's terrible. The opiate problem in these rural communities. So, video counseling. So, I'm kind of thinking about all that stuff. How can we get this done?
The Board of Nursing, we got 2 representatives here today. Oh, okay. That's true. We got 2 board members on the phone and 2 staff members here at the office today. And their function is safety. I mean, that's the overriding concern of the Board of Nursing, is protecting the public. And so I think for years, kind of the people who are against, Suboxone treatment and healthcare professionals practicing it can affect your judgment.
Yeah.
And there was an old study, probably 7 or 8 years ago, that found some small cognitive impairment. But I think there's been other studies more recently kind of saying, no, we don't see it. And so that's one of the things I'd like for you to comment on. And then the other is I've seen situations where young people, who had not a long history of opioid abuse or addiction, he put on Suboxone without even trying a 12-step approach, or a total abstinence approach. So, can you comment on those 2 things for me?
On the first one, I'll do a little self-disclosing here. Not only do I suffer from substance use disorder and alcohol use disorder, and have been in recovery for 29 years, and have been a therapist for 25 years, but I also suffer from panic. They're a drag when they get going. I have focused my counseling practice for the past 20 years on relaxation. I was talking about alcohol. I just finished a relaxing at my office with. So but I got people have addiction and anxiety is really closely tied together. So teaching people how to relax. I did a whole lot of lifestyle changes, meditation, all these different things, boundaries to help my anxiety, my panic attack. And I made a lot of progress for about a 2-year period of time. In fact, I had reduced the frequency and intensity of my panic attacks. But I couldn't get it done completely with lifestyle changes. So I went and I'm a therapist, so I knew a lot of things to do, cognitive stuff. So I got on a low dose of Zoloft. I have not had a major panic attack. The combination of those 2 things took care of me. Now, the 50 milligrams of Zoloft that I take every day for the last 2 years, does that make me feel good? I think it kind of does. I really do. I mean, I remember back, I'm a lot more comfortable on that medication. I'm a lot more social on that medication. I feel more well emotionally than before I took it. So that's kind of, I only got on it was to get rid of the panic attacks. I find a side benefit from it as well. That I have a better well-being state. So to get to your question, I haven't gotten off of the Zoloft yet. I've thought about tapering off, just like a patient on Suboxone. When is the right time to taper? It's an individual choice. That kind of thing. So I thought about tapering off. I haven't done it yet. If I taper off, am I going to be more clear? Or am I going to be, I don't know exactly what I'm looking at when I do that. But I'm functioning pretty well right now. So the question of, was your question about clarity?
Well, just, I think where I was going, the safety issue, the cognitive impairment, and the second question was...
I'm cognitively impaired on my Zoloft. I don't know. I don't know. Is somebody cognitively impaired on Remeron or something for bipolar? I don't really know the answer to those questions. I think that the FDA has determined that they're safe medications. I guess the nursing board allows people to take them. So are we on a path that Shabbat viewed the same way? I don't know. Quite possibly so. The amount of stigma against Suboxone is unmerited. Regardless of where the long term goes with it, there's a whole school of thinking and stuff that's way off base that's preventing it from being used more often.
Yeah, I would hazard to guess I'm more concerned with the use of benzodiazepines in the nursing community than anything. And actually, the keynote speaker at the conference center last week, she said that about halfway through that this is something that's under the radar, but it's slowly coming into the general public.
Nurse that has a doctor that prescribed Valium for the hospital, right?
Yeah.
I would think that if that's okay, I would think that Suboxone dealing with people that are already impaired. I guess.
For the most part, yeah.
Okay, well, that's the answer to that question as far as I know. What was the other one?
The other one is putting people on it before they've ever been given an abstinence-based treatment model. Yeah.
I think we should be real hesitant about that. I kind of think, first of all, when you say abstinence-based and you go immediately to the 12 steps, I'm kind of in a different mindset there. I think the 12 steps are good for everybody. And some younger people, it's maybe cognitive therapy, a good therapist, a life coach, some other alternatives could be there. But to put them on a medicine that they will become physically dependent upon, maybe not. Individual case, I think. However, those that are having, that have a longer track record or having trouble staying clean, have been in and out of for a long time, really good idea to try Suboxone, I think.
Yeah, I would agree. My personal feeling, I kind of use the diabetes analogy, is that unless you just have to have insulin, try diet changes.
Absolutely.
First, before you go to the insulin. Some people don't have a choice, but it's brittle. But that's the way I feel about Suboxone. You ought to try the traditional approaches, abstinence-based first.
I'm a little bit further along on that, further to the other side on that. The event of if somebody is depressed and they can't get out of bed and they're hopeless.
Yeah.
Do you try therapy first? Do you try antidepressants first, or do you try a mixture of both? That's a good question. It's the same question to me.
Yeah, and basically suicide around this issue. So if you withhold it and they suicide, in retrospect, should you have given it? But I don't know. I ought to try the other method. You're right. I think
least restrictive.
Yeah, I think you're right. Everybody's an individual. You got to look at each case how the circumstances are.
My experience is that the medication is very effective. It doesn't get abused as much as people say it does. Mainly the black market for it. So it is, if you abuse Suboxone, you're a cheap date. Because there's a lot of drugs that get you a lot higher than Suboxone does. So a lot of people don't abuse it, but they certainly have a black market for on the streets of diversion for if you can't get what you want. Yeah. And you know what? And I don't agree with selling Suboxone on the street. And we work really hard to eliminate diversion. Like Sublocade that has come along. It's injectable. Are you familiar with that? I have a bunch of patients that are on that. It's a Suboxone injection that they put in your stomach and like a little underneath your skin.
Okay.
There's not going to be any diversion. There's not. And it lasts for a month. And so, but even if somebody sells somebody a Suboxone strip on the street for $30, if that prevents that person that day from accidentally injecting fentanyl, dying, that's a plus for me. A lot of bad drugs out there right now.
I think, and again, I think when we go back and we look at who we're dealing with and the boards we represent and their wishes, we have to be very careful. My personal feeling on this is that it ought to be used more.